Good morning to my viewers out there. Tom Norris here with Norris Chiropractic. I wanted to touch base on what we're actually doing here in the office. So many people come in and say they want to get popped and leave feeling better, but don't quite understand what's going on. So the pop is basically a pressure release from the spine. When we take a spine segment where the two bones come together, there's joints that allow for movement. When that joint has the right amount of force to actually move the bone, the joint opens up, releases gases, and that's basically what the pop is. It always feels good, but the therapeutic or important part from what we're doing from our standpoint is unlocking the spine and creating movement. So many people come in and they say, I'm a believer of chiropractic, or I think what you do is going to help, but my husband doesn't believe in chiropractic. Well, let me set the record straight. It's not a theory. Chiropractic is not a theory. It's a science, which means it's not believable versus non-believable. Now you can like chiropractic versus not like chiropractic. That's that's valid. But not believing in the science is ignorance, because it's not believable versus non-believable. It's factual. It's almost kind of like saying you don't believe in a cortisone injection. You may not like a cortisone injection, but whether you like it or not, if you squirt a joint with steroids, it's going to reduce inflammation. There's nothing to not believe. Same thing with chiropractic. So basically, my job when you come in to get popped is to determine where that functional or mechanical imbalance is in the spine. Here's my spine. It's been used for probably 20 years as a prop. But anyway, where bones come together, you have small little joints there that allow for that movement. Well, different stresses throughout daily activity create stress on that spine, and in fact affects the way that it moves. My job is to mechanically get in there, figure out where the joint surface is locked up or not moving, which in turn will create an inflammatory response, which creates pain. It creates muscle tension, tightness, and if the joint's locked up long enough, it'll create spasm. Muscles move bones, obviously. Well, if the bones aren't moving right, then the muscles are working harder than they need to. So my job is to go in, restore movement scientifically, not theory-based, restore the movement, which in turn is going to decompress the spine by loosening up the muscles, making your spine work better, feel better, and in the long term last longer, because movement is what keeps the spine healthy. So next I'm going to show you a clip of our science based chiropractic care where a patient is going to have a lack of movement. We're going to go in there and scientifically, and not theoretically, scientifically get in there and restore movement to the locked up spine. Okay, so we are back here with our patient who has graciously let us video the adjustment. Back to what we were talking about as far as the range of motion and getting rid of spinal restrictions. Our patient here is a good candidate to show the imbalance in movement. So if you want to come in a little closer here. So we're going to check her pelvic and lower back movement. She's having some sciatic nerve pain related to her pregnancy, but we can also help with they call it pseudo-sciatica or pregnancy-based sciatic nerve problems through chiropractic care by decompressing the spine. So is what we're going to do. If you want to lift this leg straight back off the table as far as you can, there's good movement there. Okay, now we're going to do the same thing with this side. Okay, not nearly as high over there. Again, let's remind our viewers, lift this side back one more time. Good. Same with this side. Okay, perfect. So is what we will do, we're going to go ahead and lay on your side so this side is up facing me. I'm going to move our pillow. So as you roll, there we go, perfect. So we are going to go specifically right here where the joint is locked up and not allowing her leg to go up as far as the right side counterpart. just going to simply twist some range of motion right here. Perfect. And we're going to go to the other side. If you want to go over there. Perfect. Nice. And we will, I'm going to help you set up on the table if you want to swing your legs facing that way. And you can stand up for me, patient. We're going to lay face down for me one more time. And we're going to recheck that. It's called hip joint extension, but basically we're going to lift this side straight back off the table again. Very good. Same with this side. Awesome. Perfect.